Anesthesiologists of Reddit. What was something you won't forget hearing from someone that was under? My husband was put under to get his wisdom teeth out. He was a little anxious and also is just kind of anal. He's an engineer. So he read his pre-op instructions front to back like a dozen times. One of the things it said was you may experience profound disorientation upon awakening. As he woke up, he opened one eye and looked around the room, then said extremely huffily, "I wouldn't call this profound." Then he started crying. I was giving a young female patient sedation for a routine colonoscopy, and as I pushed the propofol, sleepy medicine, it started to hit her. She sat straight up and yelled to everyone in the procedure room, "I shaved my asshole for you," and she flopped down on her pillow and she was asleep. I was coming out of the fog of anesthesia from a colonoscopy. Apparently I didn't recognize my wife and refused her affections, telling her she was pretty, but I was married. Got big brownie points for that. My dad asked my mom to pick up his butt cheek so he could fart and it was too heavy. Anesthesiologist here. For better or for worse, I'm a big Green Bay Packers fan, so I wear a scrub cap with the Packers name, colors on it. I was doing a pre-op evaluation on a kid who was a big New Orleans Saints fan, and when I walked into the room, his first words to me were, "Packers suck." I laughed and continued to prepare him and his family for his redo open heart surgery procedure. Fast forward to surgery a couple days later, and his mom had come back to the OR as he was going to sleep. Given the fact this was a 3 or 4 time redo sternotomy, going into the chest again, he had a higher risk of major complications from the surgery. I started to push some meds to have him go to sleep while his mom was holding his hand, and as he drifted off, he said, "Wait, I have to tell my mom something." She got emotional saying how much she loved him, and we were all waiting to hear what he had to say so urgently. I paused giving him the medication, but he was already well on his way to being under, and as he drifted off to sleep, he said, "Packers suck. Kid did great, hope he is. Doing well smiley face. Edit. RIP inbox, thank you for all the awards. The kid did great, and hopefully will not need any more surgery for 20+ years, cheers everyone." My husband had his ACL and meniscus repaired. When they brought him back into the room, he stared at me through half-closed eyes until the nurses left and then said, "I love you. I'm glad you're here." I melted. Then he conked back out for about half an hour and woke up with a big gasp. I thought he was in pain. That's how loud it was, and went, "Burger King burgie ear rrrrrr." I said, "You want a Burger King burger?" He said I do. So I had to get him a Burger King burger for dinner. He doesn't remember anything until he was back home several hours later with Burger King sitting in front of him. Lol. Nurse here, was 22F, had a teen boy come out of anesthesia who looked at me and said, "Hey, you're the girl from last night." I had to reassure everyone that that wasn't me. I had a surgery to remove bone spurs from my big toes in early February of 2005. I woke up while the doctor was grinding the bone down and asked if he thought Donovan McNabb could lead the Eagles to a Super Bowl win. He nodded at the anesthesiologist and I don't remember anything after that. As an Eagles fan, he wasn't wrong to put you back under. As I put someone out for a colonoscopy one time, the patient said, "You're cute. Are you gonna see my butt?" Then she was out. Edit for those of you asking. Yes, for colonoscopies we typically use deep sedation. This is in the US. 99.9% of the time this means propofol, the Michael Jackson drug. Most of us will give some lidocaine through your IV first. This helps prevent the burning sensation in your IV that propofol can sometimes give, and follow it right up with propofol to knock you out. Almost never need analgesics like fentanyl. I gave a patient an IV dose of ketamine for a pain procedure. He proceeded to tell the room that everyone had turned into cartoon characters and then he announced he was melting into a wall of butter. Still my finest achievement as a physician. My wife was all doped up during her C-section and asked the anesthesiologist, "Did they cut me open yet?" He calmly told her they did. To which she replied, "Aw shit," with a huge grin on her face. The doctor and I lost it. Edit. Wow, this blew up overnight. Thanks for all the awards and stories. I'm scrolling through everything laughing my ass off. Y'all are the best. I had a C-section and wouldn't shut up about how I felt like I was floating in the ocean. I offered the anesthesiologist a hit of the good shit, and completely forgot I was getting a baby pulled out of me. They brought my son over to show me and I told the nurse it was a cute baby, then asked if it was Maria's. I didn't know any pregnant Marias at that moment. They brought my firstborn over to show me and I said he's loud and he doesn't purr like my kitty does. He's 20 now. He's still loud. He still does not purr. I'm sure the anesthesiologist that did my son's dental surgery will never forget him. Specifically, because he came out after the fact clearly trying very hard not to laugh to tell my wife about it. Kiddo was just chatting away while he was getting ready. Now my son is autistic and at the time had a very distinct way of speaking and pattern of emphasis along with a lisp. I literally cannot translate how he sounded talking into text. Edit. Thanks, you, Schmobzola, for giving me a good idea of actually how to describe this. Imagine you had a soundboard of Butters from South Park that had all these words on it from vastly different conversations and strung them together into the sentences below and you'll have a pretty decent idea of it. He sounds a bit different than my son, but it's about as close as I can get. Anyway, just as they're getting ready to put him under, he goes, "You're gonna need some hardcore nighttime medicine cuz I have ADHD and out," practically snoring even. They get to work, finish up and pull the mask off him. The literal second the mask was off his nose he bolts upright and finishes his sentence from however long earlier. That stuff don't work good on me. Windows XP reboot sound. My daughter had dental surgery as well, and I imagine the nurses remember her well. All 25 pounds of my 3-year-old woke up pissed and ready for a fistfight. She screamed and yelled so loudly that I could hear her from the waiting room. They pulled us back early, in the hope she would calm down when I got there. But nope, she screamed just as loudly at me. She also refused to put her clothes back on, and at one point while I was trying to wrestle her into her shorts, shoved me and whipped them back off. I wrapped her in a hospital blanket, carried her, kicking and screaming, to the car and strapped her in naked, where she promptly fell straight to sleep. Woke up when we got home and was her sweet as pie little self again. As far as I can tell, she remembered none of it. It was wild. One of my patients coming out of sedation embarrassed her husband who was in the room by saying that during their sex he likes to have Vicks rubbed on his backside. Thank goodness I'm not the only one who wants open air passages while I get my fuck on. Little known fact that used to be listed as an intended use on the box. Kind of on topic. When my mom woke up after having a stroke, the doctor asked if she recognized the people in the room. She got my sister's name right, called me my brother's name, and smiled real big at my stepdad and called him asshole. One guy said, before falling asleep, "Whoa. That feels like a dime bag." I ask a patient after surgery how he feels. He opens his eyes, stares me dead on and says, "With my fingers." Then he goes right back to sleep. Apparently when I was going under I told the anesthesiologist, "Don't mess this up, I know where you work." My husband had knee surgery. After he woke up he half yelled half whispered APPPPPPP Li Jui ECE, so the nurse gave him apple juice. Several small cups full. He grinned like a toddler and said apple juice and immediately flopped back and went back to sleep for all of 10 minutes until he woke back up gasping that he couldn't breathe. His mom, who I had met maybe 1 or 2 times at this point, went up to the foot of his bed to grab a nurse in the doorway and he bolted upright. That man projectile vomited pure apple juice directly into her face, body, the wall, the door, hallway. I have never seen anything like it in my entire life. His mom stood there soaked in juice vomit and he just rubbed his eyes and said, "Aw, I feel better, bam." Back to sleep for another 2 hours lol. I was told after surgery I said I love dogs and I want to eat the Taliban. At least you said it correctly. A little girl was going under and she was holding her mother's hand. She reached out for my hand with her other and as she was going out she joined mine with her mother's and said, "You would be a nice daddy." I probably went beetroot red as I blushed. I woke up singing the Magic School Bus theme song while someone 3 beds away was screaming in agony. In my defense, your singing was really bad. Not the anesthesiologist, but as a surgery tech working next to them. Patient, woozily. "Doc, will I still be able to integrate after this?" Gas passer. Integrate? Like what? Patient. Like the sum of f, x, from a to b when. Gas passer. Pushes more milk of amnesia. My husband woke up from anesthesia after a colonoscopy just after the doctor walked in. He didn't see the doctor and told me, "No blowjob for you," then fell back asleep and ripped a big fart. The doctor looked at me and busted out laughing. He said not to be embarrassed. People say the weirdest things, but this one he'd remember. Was under anesthesia for a breast reduction. As I was coming out, my nurse was talking to me and apparently I started saying, "OMG, it's an angel and she looks like Barbie." I kept yelling for Barbie Angel and possibly kept trying to hug her and pet her hair. I cried for her on the way home. She called to check on me later that night and referred to herself as Nurse Barbie Angel. She was the sweetest. My aunt, who notoriously despises fast food, old Mexican lady whose food is as good as it gets, woke up and looked at my uncle and said, "Are you the sexy man that's gonna take me to McDonald's?" If you knew her you would know that she would never say that. She has never lived it down. I was under general anesthesia to get my gallbladder removed. As I was being wheeled back through the double doors there was a giant TV screen that listed the surgeries going on. I was way too loopy to actually read it, but I swear I saw elbow-ectomy, and started hysterically laughing over the idea of removing an elbow and being left with a floppy arm. Apparently what I actually said was, "Elbow jello," and then passed out. Am an anesthetist. Woke up a 70-year-old PT who got a penile prosthesis implant for erectile dysfunction. First thing out of his mouth in his post-surgery stupor was to request a private room and find out when he could take this baby out for a test drive. He was a happily married jokester. I got put under for my wisdom teeth at 17. When I came to, the nurse or whatever was like, "Okay, you're probably a little groggy, just sit tight for a while." And I was like, "Fuck that, I feel amazing." And proceeded to swing my legs off the table, which sent my top half spinning right after it and falling flat on my face. People laughed. I remember the laughter. A girl woke up and asked if she had been hit by a train, and then when asked if she knew why she was there she looked down and patted her chest and said implants. She was having her ACL repaired and her mom was there. It was me, I was 19, I've never lived it down. Patient here. Came out of anesthesia and heard Gaudier's Somebody that I used to know playing in the recovery room. I asked my so why they were playing it at like 10x the normal speed and the nurse just goes okay, so she's not ready to go home yet lol. I was brought home after by my wife but was still loopy. She told the construction workers outside to make sure I didn't leave the house. They let me help pour concrete and fixed what I fucked up. Nice guys. My daughter made them free limeade so they were always cool with us. This guy the first was dating, he asked me to take him to get his wisdom teeth removed. He told me that anesthesia doesn't affect him a lot and we were supposed to go on a road trip the next day. So anyway he gets wheeled out of the dentist by an old nurse. I'm behind the driver's seat and I see him smacking his lips looking up at the sky. She opens my car door and he said, "I love her, I love her." He then proceeded to ask me to marry him several times. He tried to pull out his gauze and I told him stop and he said, "Man, this bitch is bossy." Then he wanted a milkshake. I would suggest a place and he would scream no. Finally we agree on a place and he tells me he'll give me directions. I drive for 15 minutes before I ask him what we're doing and he said he has no idea. We're in the drive-thru and he says, "I have something for you." I swear I thought he had bought me a ring the way he had been proposing for last hour. It was his newly extracted teeth. They let me keep them, "I want you to have them," he lived on base at the time. And was yelling at the gate while they checked his ID for them to, hurry up. I finally get him to his room, in bed. He's happily eating his milkshake with a spoon. His mouth was a mess of blood and milkshake. He asked me for a kiss. I gave him a peck. We're married now. Edit. Wow. Thanks for all the love y'all. He's just as sweet when he's not sedated too, so I'm a lucky girl. Ah, so you accepted his teeth proposal. A wise choice. Patient here, I was a teen. Apparently before I went under I kept mumbling, "It's buried, don't worry. Stop worrying, it's buried, it's gone." My mom was there, said the staff were eyeballing her uncomfortably, and years later to this day every year she still asks me if remember anything? That if ever I need to talk she'll support me no matter what. I honestly do not know what I meant. I'm an anesthesiologist. The best story was a 40-some-year-old woman for appendectomy, said while I'm giving the propofol to induce anesthesia. She said, "Oh, I don't remember it tasting like that before," slurred. I said, "What does it taste like?" Since propofol doesn't usually elicit a taste reaction. She almost yelled, "D's nuts," and was promptly under anesthesia thereafter. There have been other stories, but this one has the entire OR staff rolling laughing for minutes after she was under. Had my wisdom teeth out. When I woke up I was so excited to get my now extracted teeth and keep them as a souvenir. The nurse said I couldn't. She wheeled me out to the front door where my wife was waiting to load me into the car. She saw my disappointed face and asked, "What's wrong, honey?" I turned and pointed to the nurse and said through my gauze-stuffed mouth, "This fucking bitch won't let me keep my teeth." My stunned wife apologized and the nurse explained that it's fine but they were a biohazard, to which I replied incredulously, "They were in my fucking mouth an hour ago." Edit. On a slightly related note, my mill has promised me that I can have her titanium hip after her cremation for a shifter in my car. Love that woman. Apparently you didn't have that fucking bitch as a nurse. My husband had to undergo a colonoscopy and when he came around he started aggressively grilling the staff about Abraham Lincoln. He isn't a historian or anything, he works as a business analyst and knows next to nothing about Abraham Lincoln. Bonus story. One time he took Ambien and got super fucked up. Initially told me that he couldn't walk up the stairs to bed because he was a transformer and his legs had turned to wheels. Finally got him upstairs and he made the observation that if peach trees could sing to each other like whales it would be beautiful. I bet they would sing Adele. Then he burst into tears. I had an ovarian cyst removed a year ago and woke up from the anesthesia saying, "Hand. Hand please," and making grabby hands with both my hands until the nurses finally came over and held my hands for about 5 minutes while I just smiled and tried to go back to sleep. I hadn't done that in a decade. I used to do it to my dad all the time as a kid to express that I wanted to hold his hand while I slept. My mom woke up from dental surgery and when we were leaving the surgeon's office, he gave her a goodie bag with floss and a toothbrush and stuff, and the whole way home she kept asking if she could eat the candy that the dentist gave her. Every time I told her there was no candy, she looked so heartbroken, like a little kid when their goldfish dies or something. Then we stopped at CVS on the way home and she wandered off. I found her in the candy aisle holding a giant bag of fun-sized candy and when I told her to put it back on the shelf she dropped it on the floor and galloped away laughing at me. I have had to get colonoscopies every couple years since I was 24, so I've gone under quite a bit for someone my age. Every time, when I wake up, I'm crying, and a nurse is comforting me. They say I don't tell them why I'm upset, but I'm weeping every damn time. It has gotten to the point where I warn the nurses I'll be sobbing, but to not take it too seriously. Anyone else have this? Edit. Okay, wow, so this is very common. Thanks everyone for sharing, I legitimately feel less weird now and I appreciate it. I've learned. 1. I'm apparently very lucky to not be vomiting alongside the weeping too. I should tell my anesthesiologist about this reaction, and they can switch up my drugs and possibly help avoid this reaction in the future. 3. Not everyone gets put under for colonoscopies, and I think this may be a geographic difference. I'm in the US. Lastly, for those asking, my mom died of colon cancer and they found 8 polyps when I was 24. Fascinating, so many of us are in the same shitty club. As a reminder, please do not delay if you have colon cancer in your family or you are 45 or older. It's not fun, but it ain't that bad, and it can save your life. Schedule it now. This is your sign. Do it. No, I'm usually aggressive. In the 5 times I've been put under I have almost exclusively accused people of stealing body parts and or another crime. Wisdom teeth was kidnapping and my kidney. Gallbladder was my murder. Appendectomy I accused the poor nurse of disposing of my family and I would make her pay. Fractured skull, brain injury I cried in anger because they wouldn't give me back my face. Was recently under for abdominal surgery. My partner of 17 years who I dearly love was the first face I remember seeing when coming out of anesthesia. I looked at him, said, "Who the FK are you? Why are you staring at me?" He's still laughing. I was 17 at the time but got my wisdom teeth taken out. Everything went as planned, but I woke up and remember seeing the oral surgeon. Me. Being dosed with grade A giggle juice and having no idea WTF I was doing. Asked her if she would like to grab boba sometime. I've never been so embarrassed in my life. 5 years later, she let me shadow for part of my dental school shadowing requirement and is giving me a lure for applications next cycle. Not a boba date, but all things considered, she was a great mentor. My boyfriend at the time had just gotten his wisdom teeth removed. On the ride home with his mouth full of gauze, he gets a call on his cell phone. He answered it and just starts talking away. Whoever it was on the other side could not possibly understand a word he was saying with all the gauze in his mouth. But man, he had a lot to talk about and they apparently didn't hang up. After about 5 minutes of this unintelligible phone conversation, he looks at me and says, "Ooh, ithh a robot," and gives me the phone. I put it to my ear, and the whole time it's been the Walgreens pharmacy automated notice simply stating his prescription is ready for pickup, playing on repeat. Probably for the best. Am patient's relative rather than anesthesiologist, but as he started going under, patient, hydraulics engineer, started trying to tell the doctor what type of pump they should install to fix the busted blood vessel in his brain. I'm a hobbyist mechanic and a huge gearhead, and while falling asleep I have caught myself wondering how big of an engine I could swap into my cat. A Cadillac V6. My dad is super resistant to anesthesia and most pain meds, which sucks for him. He warned them when he went to get his hip replaced, but evidently they ignored or underestimated his statement. Mid-hip replacement, he woke up, sat up in his seat, and attempted to strangle the doctor to death. He got far closer than a man in his condition should have. When I say mid-hip replacement, the hip was fully replaced. They were about to begin like closing the hole, or whatever the terminology is. I have no recollection of this, but according to my mom, when she met me in the recovery room after wisdom tooth extraction, I was very eager to tell her something, but my mouth was full of gauze. So they gave me a pen and I wrote something on the surgical bib. Hours later, when I was back in reality, she asked me, "What was with the meow meows, my son?" I had no idea what she was talking about, so she showed me the bib. It said, "Meow meow 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 meow," the Meow Mix theme. I had a guy, nefarious character, heavy drug use history, who got a bunch of ketamine, probably too much, in recovery from one of the other docs to help with severe pain after his abscess drainage. I was asked to check on him in an hour as the other doc had left for the evening. Went over and saw him in the K-hole drooling on himself but otherwise fine, so I left and came back an hour later. First thing he says to me is, "Why did you do that to me?" I asked him what he meant and he said, "You don't understand, I lived another man's life in there." I apologized and asked him, "How long do you think you were in there?" For reference, it had been something like an hour and a half or 2 hours since his trip began. "I don't know, maybe 30 years." I was speechless. I apologized again, made sure he knew he was safe, made sure he wasn't hurting, and made damn sure he knew it wasn't me that did it to him. TLDR, patient time traveled 30 years in the K-hole. I've heard of people who have dreams that are so vivid that they live entire lives in them. It fucks them up when they wake up. They have memories of their kids who were never real. One time a male biology student in his early 20s with a stuck kidney stone, was being put under for surgery. Just as the anesthesiologist was pushing meds and telling me to count back from 100, I looked up at him in a drugged but focused gaze and said, "You're so pretty. You could be in movies." Then blackness. Anesthesiologist was like a grizzled 70-year-old hunched back-looking guy with a lopsided grimace and more ear hair than head hair. Great doc though. Very last thing I remember hearing was the OR nurses cracking up laughing. It was a smallish medical community and I knew some of the people there, so as a joke somebody snuck his headshot into my chart. I like to think it was him gunning for a second career though. Edit. Due to the rather sensitive nature of the surgery, he hit me with a wallop of midazolam on the way into the OR, so I was already pretty juiced by the time they started. I had a colonoscopy last month and woke up rested and totally lucid. Bummer. However, when my husband had his vasectomy after our son was born, they gave him a local, it's an outpatient procedure, and some Valium and pain meds after. He was loopy. I stopped at Walgreens to fill his prescription, and he said, as he lolled in the passenger seat with a ice pack on his genitals, "Hey, will you get me a Coke?" I nod. And some Doritos? I nod again and go to leave car. And some Oreos? And some Reese's Cups? And some Twizzlers? We were 38 well behind junk food years, not stoners, and he was 6 feet 2 inches and 170, not obese or a binge eater. I said, "Are you serious?" And he grinned drunkenly and said, "Yeah." I grabbed the baby carrier and said, "I'm taking the baby with me." He literally did finger guns. This man is a college professor. Who wears bow ties. I buy his snacks and painkillers and head back outside, and he is telling a guy at the red box video kiosk next to our car that his urologist said he had the best kind of penis for the procedure because his shaft is very straight and uniform. I took him home quickly, gave him his snacks and let him sleep it off. He woke up hours later covered in candy wrappers with orange Dorito fingers and asked, "What happened?" That was 13 years ago and it's still the best. My son, then 10 or so, was coming to after being under when getting his broken wrist set and casted. They had to do traction to get everything aligned or something. There were quite a few people in the room, but his drugged self directed all his attention to me. He was describing Big Daddy from BioShock and kept repeating, "Dad, you know what I'm talking about." Because I couldn't think of the name of the game at the time. Then he gets frustrated and yells at me, "You son of a bitch." Lots of laughs from the hospital staff. Surgeon told me that I kept them all laughing through my facial surgery. They had to keep giving me more anesthetic to shut me up, which is probably why I was sick as a dog afterwards. I pressed him hard for details but he refused to tell me what I'd said. How about the other way around? I took my mom for her surgery on her right shoulder and her anesthesiologist was this very dignified, solemn older Persian gentleman. My mom told him, "Just so you know, I wrote directions on myself to make sure you get it right." She was joking around, but she actually does this. Old battleaxe nurse habits die hard. He looked her straight in the eye and said deadpan, "Great. So let's get started on your left knee." Totally got her. It was great. My aunt got rushed to the hospital for abnormal heart rate but it wasn't a heart attack or stroke, but her heart was going at like 200 beats per minute or whatever it was. They had to put her under so they could shock her heart back to normal. As they're taking her under, the doctor says something like "okay," and it goes and she immediately quips with "that's what she said." All the doctors and nurses busted a gut laughing and told my uncle when he got there. He just shrugged and said "that's my wife for ya." One summer I was home from college and my dad needed me to pick him up after his very first colonoscopy. He was nervous so I got there early. The nurse called me back and asked me to help wake him up, as they were having some trouble. I go back and am making chit-chat. "Oh Dad, you've got those cool booties on." He raised his head a little bit to look at them then yelled, "Booty call." He is a Presbyterian pastor. A moment I will treasure forever. As a 17-year-old I had a colonoscopy because GI doctors couldn't figure out why I couldn't go number 2. I mention this as an important detail, because after the colonoscopy I was still very much under the anesthesia effects, loopy, and when my mom tried to offer saltines I started screaming, "How many calories do those things have?" And my mom starts panicking like, "Calm down. Lower your voice. People are gonna think you have an eating disorder or something." And I just said, "I can't talk quiet, what's going on?" The ironic thing was I guess besides dysregulating my ability to control vocal volume, the anesthesia kind of acted like a truth serum in a way. No one found out I had an eating disorder until I almost died from it a year later, but I can't believe that wasn't taken into consideration as to why I couldn't go to the bathroom. Can't poop if you don't eat.